Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published in June and July 2023 that we hope might be of interest to the VieSID community. So let's begin. In Cranio, we found a paper of our interest by Araya Pisit et al., where condylar morphology as derived from panoramic radiographs was interpreted in parallel with CBCT images. As pointed out by the authors, CBCT and CT images are the most suitable for the evaluation of the skeletal component of the TMJ for detecting alterations including joint remodeling, erosion, or osteophytes and subcortical sclerosis. However, acquisition of these data might be difficult owing to high costs and low availability. Additionally, patients' X-ray exposure is a limiting factor. Thus, with this retrospective study, Araya Pisit et al. Explored the correspondence between findings from panoramic radiographs, which are usually easier to obtain and are low on radiation dose, and CBCT images in 178 patients' records. Additionally, they evaluated association between condylar morphology and factors such as age, sex, and missing posterior teeth in a higher number of panoramics, equal to 3,000. As indicated in the figure 1 shown here, the 2009 classification for condyle morphology by Oliveira et al. Was used as reference. This includes the following morphologies from left to right in the figure: flat, pointed, angled, round, and irregular. CBCT images, which were taken within 6 months from the panoramic images, were evaluated on the different planes to assess the shape of the medial, lateral, and central aspects of the condyles. Let's now explore the table reporting the main outcomes of the study. Condyles appearing as pointed in the panoramic were mainly round, but could also be pointed or flat. Flat condyles could either be round or flat in the CBCT. An angled shape in the panoramic mostly reflected round morphology in the CBCT, but could also be flat or pointed. So an angled shape does appear to be an artifact of image projection. When the condyle appeared as round in the panoramic, then it most probably was, although it could have been also flat or pointed in some cases. So in my opinion, these results show that the panoramic radiographs can provide an indication about condylar morphology, but in no way can assessment of TMJ morphology be based on panoramics. With regard to the epidemiological assessment performed on 3,000 panoramic radiographs, the authors found different distribution of classes between males and females due to different prevalence of flat and pointed condyles. They also observed an increased prevalence of flattening in older subjects and noticed an increase in flattening corresponding to an increased number of missing teeth. So the results by age and missing teeth are in agreement with previous studies. The Journal of Evidence-Based Dental Practice introduced a grading system for the evaluation of publications testing the quality of diagnostic and therapeutic procedures with respect to an average patient. This procedure is called Strength of Recommendation Taxonomy, or SORT, and is usually used for the evaluation of evidence about a single procedure or a new product. This system is based on key elements such as the quality of the individual studies and the consistency of evidence across all the studies. The single studies can be classified into 3 groups based on the evaluation of the level of evidence with specific indications for the cases of diagnosis, treatment, or prognosis. Evidence can be evaluated as consistent or inconsistent. This evaluation may result in 3 possible grades, A, B, or C, with grading A reflecting consistencies, good quality of evidence, and grading B and C reflecting a decrease in quality and consistency. The Journal of Evidence-Based Dental Practice recommended this grading system because it is straightforward and comprehensive. It addresses the issue of patient-oriented evidence, which is evidence of interest to patients reflecting improvement in morbidity, mortality, symptoms, quality of life, or costs. And this is easy to apply. This is the reason why I decided to show it to you, as you might want to apply it when studying a particular topic. Its simplicity can be seen as a limitation. However, the editors of the Journal of Evidence-Based Dental Practice preferred it to the previously used system because it considers all observational studies too weak to support clinical recommendations. In the Journal of Oral Rehabilitation, Kwang et al. Published an article testing the effects of mandibular advancement appliance on jaw closing muscle activity in patients with obstructive sleep apnea. It has been postulated that contractions of masseter muscles after respiratory events are dependent on the duration of respiratory arousals rather than on the occurrence of the respiratory events per se. And sleep apnea episodes with transient hypoxia would trigger rhythmic masticatory muscle activity. Thus, the authors explored the effects of mandibular advancement therapy on time-related jaw-closing muscle activity associated with oxygen desaturation, with or without respiratory arousal in individuals with sleep apnea. They performed polysomnography on 18 patients with sleep apnea, with and without mandibular advancement appliance, after a period of habituation to the device. I will report here on the main results of these studies. In this plot, the indices of the jaw closing muscle activities associated with hypoxia, with respiratory arousal, without and with mandibular advancement appliances are compared. As you can notice, the jaw closing muscle activity associated with hypoxia was present in most of the patients and was reduced by the use of the device to various degrees, but consistently. Here, the indices of the jaw closing muscle activities time related to the saturation without respiratory arousal are reported. In this case, the authors reported no significant changes. However, I would read these results a bit differently, as according to this graph and its caption, 13 subjects didn't show jaw closing muscle activity associated with hypoxia without respiratory arousal. In 3 subjects instead, they were present and were reduced by the use of the mandibular advancement appliances. So the case instead of the subject showing negative outcomes with an increase of the index value when using the appliance wasn't discussed in the paper. So the study here is limited in the number of subjects and mostly in the use of polysomnography portable devices that are known to be inaccurate. Also, the authors explained that the audio-video recordings during polysomnography, which usually help interpreting the output variables, were not available. However, I think we can conclude that this contribution showed an improvement of respiration and sleep quality thanks to the use of mandibular advancement appliances in patients with obstructive sleep apnea, with a reduction of muscle activity associated to hypoxia. In orthodontics and craniofacial research, a paper by Rongo et al. Addressed the topic of TMJ arthritis in children and adolescents and provided a report on its management, mainly conceived for orthodontists. Juvenile idiopathic arthritis consists in persistent inflammation of the joints caused by an underlying systemic inflammatory disease. It is estimated to affect 1 every 1,000 children and develops before the age of 16 years. It persists for at least 6 weeks and doesn't have identifiable causes. TMJ involvement is estimated to be present in 17 to 87% of the cases, depending on subtype, diagnostic criteria, and ethnicity. The authors pointed out that TMJ involvement might not be directly caused by autoimmune-induced inflammation in these joints, but may be the result of a sequela of adverse events triggered by chronic low-grade inflammation of the joints. Patients with juvenile idiopathic arthritis may experience joint or muscle pain, fatigue, reduction in muscular strength, and bone damage, leading to impaired quality of life. The most common signs and symptoms reported in case of TMJ involvement are reduced mouth opening capacity, pain during jaw movements, tiredness of the jaws, and impaired mastication, possible mechanical overloading caused by previous TMJ inflammation. As a consequence of TMJ degeneration and dysfunction, juvenile idiopathic arthritis may result in abnormal facial growth consisting in retrognatic mandible, concave face profile, and asymmetric facial growth when only one side is affected. The management of TMJ arthritis has 5 main aims, according to the authors: providing timely diagnosis, reducing TMJ inflammation, reducing TMJ symptoms and dysfunction, normalizing dentofacial development, addressing dentofacial deformities. In the paper, the authors emphasize the importance of interdisciplinary collaboration, including rheumatologists, radiologists, and dentists in the team for the diagnosis and management of TMJ arthritis, which with differential diagnosis is challenging. They stress also the important role of orthodontists in both diagnosis and patient's treatment. A quick clinical examination for preliminary evaluation of the patient was suggested for the evaluation of TMJ pain, sounds, and function, and evaluation of facial profile and asymmetries. The authors recommended the use of MRI for evaluation of disposition, as well as CBCT or CT to evaluate the dentofacial deformities. They listed also a series of suitable morphometric parameters and they went on providing suggestions for management of arthritis symptoms, including a systemic therapy for reduction of body inflammation, occlusal splints, and physiotherapy. Rongo et al. Discussed also steroid injections and lavage, which they found controversial for their effects are not curative, although they provide some immediate benefits. For the management of the craniofacial deformities, Rongo et al. Reported about orthopedic functional appliance, activators, and distraction splints, together with the surgical options, which, according to the authors, are difficult to manage and entail high risk. I suggest reading this paper for the appreciation of the clinical aspects I couldn't render here. In scientific reports, Allers et al. Published an article on condylar motion analysis in which between observer reproducibility of condylar motion tracings was tested. For this study, 4 dentists with long-term experience in performing condylographic tracings were involved, 3 working in closer contact with each other and 1 who didn't have regular contacts with the rest. 20 consecutive patients who presented for diagnosis and treatment of suspected TMD were included. The tracings were recorded using the CADIAS Compact 2 system and the related CADIX software. The authors explained the choice of this instrumentation with the following points: long-term availability on the market, long-term experience of the operators in using this device, and possibility to fully display the condylar movements and obtain output variables for further analysis. The starting point of the movements was the mandibular position determined by habitual occlusion rather than reference position, This choice was made to focus on the evaluation on the movement's trajectory and minimize operator-dependent factors. For the intra-observer error, length of the tracings and geometry of the tracings were considered. The authors also provided examples of different tracings for the evaluation for the various characteristics considered, including shifts in the starting and end point, breaking point in incursion, deviation from normal length, changes in curvature, and erratic or irregular pattern. Velocity diagrams were evaluated based on their shape into single, two, or multi-peaked. Parallelism in jaw opening and closure were evaluated for the assessment of possible asymmetries. The evaluation of the results through fly-scale tests revealed high concordance between observers. In particular, they obtained a value of 0.91 on a maximum of 1, reflecting perfect agreement when they considered the outcomes for the three operators working together. The agreement was similarly high, 0.88, when considering all four investigators. The outcomes for the various parameters computed for the four investigators revealed high agreement in the various parameters collected, ranging from 0.86 to 0.92, except for the breaking point, which was 0.67, and functional coordination, 0.62. An assessment of the results among the examiners revealed unclarity in the understanding of the definition of these parameters, which the examiners resolved by means of a structured Delphi process for a refinement of the definition. Afterwards, a reevaluation of the data allowed them to reach a high score of 0.9. The outcome of this study, which I find remarkable in terms of scientific rigor and clarity of report, shows that condylographic tracing are reproducible and therefore suitable for assessment of patients' mandibular movements within the diagnostic protocol of stomatognathing function. We've come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.